So it affects the melanocytes, which is the pigment-producing cells in the epidermis. Typically, it develops from a mole. It's the most fatal skin cancer due to its high metastatic potential. Appears as asymmetrical brown or black patches with uneven borders and a raised surface. And treatments include surgical excision or immunotherapy. So the ABCDE menoic melanoma detection is asymmetry, which is two sides are not symmetrical, borders where the edges are irregular, color varies in shades, brown or black, diameter, which is larger than 6 millimeters or 0.24 inches, evolving, which is shape, size, or color changes. And additional signs are E elevated, which is raised on the skin surface, firm, feels hard to the touch, and growing, continues to increase in size. So it affects stem cells in the stratum basal layer of the epidermis. It's most common cancer in the US, often found on your head, neck, arms, or back. It's caused primarily by UV radiation, and other causes include radiation and skin wounds like open sores, tattoos, or burns. It begins in the stratum basal, spreading along this layer before moving toward the skin surface, forming an uneven patch, bump, growth, or scar. It is treatable if caught early, and it can be treated by surgery or like freezing or topical ointments. Now, squamous cell, it affects keratinocytes in the stratum spinosum layer. It's the second most common skin cancer and accounts for about 20% of skin cancers, and it appears most commonly on the scalp, ears, and hands. It is more aggressive than basal cell carcinoma, and can metastasize if not treated. The treatment includes surgery or radiation therapy. Skin cancer is one of the most common cancers, with 1 in 5 Americans affected by it in their lifetime. It is caused by overexposure to UV radiation, which damages DNA and forms cancer. And what kind of makes it worse is that our ozone layer is depleting, which leads to increased UV radiation exposure. Skin cancer can develop in areas that are not exposed to UV radiation, which kind of shows that it's not just solely caused by UV radiation. There's other factors. Tumors can be benign, which is harmless, or malignant, which is cancerous. Malignant cancers can spread to other organs, and this is called metastasis, and which kind of shows like how severe it is.
Skin disorders. Eczema. Eczema is an inflammatory skin condition, an allergic reaction that appears as dry itches all over the body. Eczema appears as a rash, and it's usually accompanied by symptoms such as swelling of the skin, flaking, and when your eczema is severe, bleeding. That probably happens from the itching of the eczema. People of all ages may be diagnosed with eczema, and symptoms are managed by using moisturizers, corticosteroid cream, and immunosuppressants, because sometimes your body's immune system attacks the skin thinking that there's like pathogens or like bacteria on it, and that's what causes eczema. But like the true cause is unknown. It could be stress, it could be your immune system, or it could be just, lack of moisture. One of the most common skin disorders that plagues a bunch of people is acne. And it's a skin disturbance that occurs in areas that are filled with sebaceous glands, which are oils that produce sebum, or oil. And those areas that are full of sebaceous glands are your face and back, which is where acne usually appears. Acne usually occurs during puberty due to hormonal changes, but it can occur in infants as well and lead and stay until adulthood. And overproduction of sebum due to the staph, like clogging up your pores, your hair follicles, and then there's like a white substance, which is the sebum, but it turns black when it's exposed to oxygen, which results in open comb domes, like that thing over there on that right, that image. And everybody hates Bacne. Thank you for listening to the presentation.